Hello, everyone. Welcome to our live webinar today on ketamine-assisted couple therapy. We are really happy that you're here. We're really excited to talk about the model and just a little bit about us. So, Kayla and I are both clinical psychologists. We come from academia where we have run clinical trials primarily focused on couples and now enhancing couple therapies with psychedelics. And we developed this model when therapists started reaching out to us wanting to learn ketamine assisted couple therapy when they weren't able to find a model available. So that's what we're going to be talking with you about today. And we're going to ask you to put your questions in the chat. We will save time at the end to go through all of those.
All right. I'm just monitoring, y'all are watching on our YouTube live, and so I want to make sure that folks can actually access the chat. So if you want to put a little tester comment in there while we're getting started, that would be great for folks who are watching live. All right, so today we're going to be talking about ketamine-assisted psychotherapy for couples. So what is ketamine and what is ketamine-assisted psychotherapy, or CAP? You'll also hear us call this ketamine-assisted therapy throughout as kind of a shorthand. So ketamine was originally developed as an anesthetic. It is a dissociative anesthetic. I see you all in the chat. Thank you so much. You're fabulous. Ketamine is a dissociative anesthetic. And then, throughout its use, folks started sort of noticing that it had some pretty profound mental health benefits. Currently, research supports ketamine treatment for a number of mental health disorders. You can see some of them listed on the right side of the slide here for treatment of treatment-resistant depression and acute suicidality. It shows some efficacy for PTSD, generalized and social anxiety, some for eating disorders, and some really promising uses in alcohol and other substance use disorders, which is really great. When we look at the research with ketamine alone, think sort of what people typically might experience going into a ketamine infusion clinic, right? They're just receiving the ketamine alone without supportive psychotherapy kind of surrounding it. We do tend to see pretty rapid, pretty robust, but fairly short-term effects, especially on depression and suicidal ideation. When we combine ketamine with psychotherapy, that's where we get CAP, ketamine-assisted psychotherapy. This is where we start to see much longer-term benefits. Mostly in the research, this has used sort of CBT or motivational enhancement approaches. Some have used other kinds of exposure treatments or insight-oriented approaches. We need a lot more research on what types of psychotherapy combine well with ketamine. What we know so far is that CAP seems to work best when we're using higher doses of ketamine to a point. There's actually sort of a U-shaped curve where if we do too high of a dose, then we start getting into anesthetic territory, and that is less helpful for mental health treatment. But among the higher doses for mental health treatment, more frequent medicine sessions, and then a longer duration of psychotherapy in support of the medicine. So ketamine works in a number of different ways in the brain. We're just going to hit a couple of the highlights here, but I really want to emphasize that ketamine's effects in the brain are pretty widespread and diffuse. It doesn't just do one thing. A couple of the things that it does that we think are helpful for mental health treatment or are likely to be helpful for mental health. One is it promotes neuroplasticity and neural growth via a cascade of hormones resulting from brain-derived neurotrophic factor. And what this means is that in adulthood, it allows us to lay down new neural connections, prune away old neural connections, and really sort of change the actual structure and function of our brains, which is not something that our adult brains are always super well equipped to do. So ketamine, as well as other psychedelics, actually seem to open up this sort of window of neuroplasticity for us. It increases synaptic communication, in part via glutamate suppression. Glutamate is a neurotransmitter in the brain. Some new researchers are referring to this phenomenon as brain entropy. It's sort of refers to how the firing in our brain becomes a lot sort of more rapid and less organized. And that might sound like a bad thing, but it's actually a good thing when we're trying to get somebody out of a normal state of consciousness, enter an alternative state of consciousness, an altered state of consciousness, and help them experience some flexibility and other ways of thinking. As a result of this, ketamine can also produce psychedelic experiences. Things like transpersonal experiences, mystical experiences, spiritual experiences. When Chandra and I work with ketamine in our practice, we do refer to it as a psychedelic. Some people will argue with us about that and say ketamine is not a psychedelic. It's certainly not a classic psychedelic, but it does produce psychedelic effects, right? If we think about psychedelic, the word as an adjective, it produces effects that are psychedelic for people. And the way that we use it in our practice, which we'll share more about in just a moment, we use it as a psychedelic medicine.
So what does this actually mean for our couples? Why are we using this for couple therapy? So as you all know who are working with couples, typically when they come into therapy, they are stuck in some dysfunctional pattern. And as Kayla was talking about, because ketamine is a dissociative, it can kind of move us out of our own way. It can kind of pull us out of that pattern so that we can look at that pattern together. And the mechanisms of change are going to be acting on kind of a cognitive domain, an emotional domain, and a behavioral domain. And what we see cognitively is that there is a lot more flexibility and openness to a different perspective. You can kind of scooch out of your perspective and see things from your partner's point of view. There is more openness and empathy when we're looking at the emotional domain. And then behaviorally, there is less avoidance. So we're able to move toward conversations that might be challenging. We're willing to sit in some discomfort in order to kind of grow and come together, have more connection, more healing. And this is a paper that we wrote. It is in Frontiers. It's open access, so anyone can go look at that. It's free. But it goes into more detail into these different domains that are our couple therapy targets. This paper goes through the model that we've developed, and then there's some kind of qualitative snippets pulled from some couples that we've worked with.
So this figure on this slide is our overview of the ketamine-assisted couple therapy framework that we've developed at Enamory. We're going to explain now how we take all of the foundations that we just talked about how ketamine works, how CAP works, and why that might work with couple therapy, and show you a model for how this could actually work in practice. Lots of folks have been working with ketamine and other psychedelics with couples for a really long time, but there, up to this point, hasn't been sort of a clear structure and guidance for applying ketamine to couples work. And that's what this framework provides. We're going to start off by describing assessment, how we build a really solid case formulation, how we help the couple understand where they're getting stuck and how ketamine fits into that treatment. Describe that to them in a feedback session, help them prepare to get the most out of their dosing session. We'll talk through some different dosing models that you might use with couples, how you can structure integration sessions with couples really effectively, and then sort of where this sits in a larger course of couple therapy.
And of course, today we are just doing kind of a brief intro into all of these different components. If you're coming to our training at the end of October, we have cases that have been videotaped. We'll go into depth in all of these. We'll role play. You'll create your own conceptualization for the couples that you're working with or the video examples. So again, today's going to be a brief introduction, but there is a lot more depth to all of this that we're happy to go through with you. So if you have attended our trainings or any consultation with us before, you've likely seen our relational pattern. This is a visualization of what a couple's relationship dynamic can look like. When we do assessment with a couple, we are trying to figure out not just, what are they arguing about and, who said what the last time that they had a fight. What we're really trying to do is figure out the underlying patterns that are underneath
sort of the recurring conflicts or the recurring issues that come up for them. In this way, we're actually going to help them shift fundamentally how they connect and relate with one another rather than just kind of solving the problem of the week. So this pattern really is kind of the linchpin of our like the keystone of our case formulation and conceptualization with couples. The way that this pattern works is that the stuff that's in the dashed boxes at the bottom of the screen, that is all kind of underneath the surface, often not visible to our partners or anybody else we're talking with. Those are internal experiences, thoughts, body sensations, primary emotions. And then above the surface in the solid lines, those are things that we can see, right? Tangible things, our behaviors, the emotions that we actually express to one another verbally or non-verbally. If you trace the arrows, it kind of makes an infinity loop, right? So what this suggests is that it's not like we're starting one particular place and you're at fault and then I respond. Instead, this is a cycle that is self-perpetuating and goes around and around. In this particular example, you can see a couple where the trigger event was one partner feeling ignored at the party, right? And so when I felt ignored, maybe my behavior was that I criticized you. I started arguing with you about what we agreed on. I expressed frustration in my emotion. And then under the surface, maybe you're experiencing something like, well, I never do anything right. I have this pit in my stomach. I feel a lot of shame. But at least, most of us are not going to be able to express that, at least right off the bat. And so instead, maybe you get defensive and maybe you shut down. And for me, that reinforces, right, my vulnerability about being ignored. I feel disconnected. I feel like I'm not a priority. I feel some tension, maybe tightness in my throat. I feel sad. I feel hurt. And you can see how this just kind of goes round and round, right? The more you shut down, the more I feel disconnected and deprioritized. The more I argue and criticize, the more you feel shame, like you never do anything right. And so round and round we go. We assess with couples, we help them build this relational pattern and help them understand sort of where they're getting stuck and importantly, where the routes out are. This is a few examples sort of that we've overlaid here on where we might think about intervening, right? And I want you to start thinking about, okay, so how can ketamine actually help make those shifts, right? As a couples therapist, right? Independent of whether we're working with ketamine or not, you might think about, okay, can I help this couple shift how they're communicating with one another, right? Can I help them actually say what's underneath the surface, their more vulnerable emotions rather than sharing defensiveness or criticism? Can I help them really listen to one another rather than getting caught up in their own stories? Can I help them shift these, stories that they have about themselves and one another that are rigid and find some more flexibility in how they understand the situation? And if you recall, ketamine can really help with all of these things. It can help us with cognitive flexibility. It can help us sit with difficult emotions so that we can make contact with those vulnerabilities and then share them. That neuroplastic window really helps us make behavior change, especially if we're working on that right in the about 24 hours or so after a ketamine medicine session. So this is where we start to think about what we want to help the couple shift as couples therapists, and also where we want to incorporate ketamine into the treatment plan to support that.
So once we do our assessment, then we're going to move into feedback and prep. And this is really a collaborative process. We've developed this clear pattern, but of course the couple is the experts on them. And so they're going to give us lots of feedback on this pattern that we've developed, and we're going to create kind of a roadmap for treatment. And so first we want to establish our set and setting. So from this pattern that Kayla was talking through, we can identify relational intentions. So maybe an intention is, I want to have a deeper understanding of why that vulnerability around not being a priority comes up. Maybe that has happened throughout my life. Maybe there's something deeper to understand. So we can kind of have intentions looking at our own history, our own behavior, and how that influences the relationship. We can have intentions about how we're interacting, but we want to think about this before we go into a medicine session. And then, of course, as everyone here probably knows, when we're doing psychedelic treatment, these are things that we hold lightly. So as much prep as we do, as much as we kind of think about our relational intentions, a psychedelic session is going to take us wherever it's going to take us. And we really want to be kind of open and willing to have that experience and see what the medicine session can kind of bring to light and unfold kind of naturally. When we think about the setting, so we have our space set up with two recliners that are next to each other. So if a couple does want to hold hands or be close, that's something that we're going to talk about before we go into the medicine session. Sometimes couples do. Sometimes couples want to be kind of on their own journey. I just had a session with a couple where one person wanted touch, the other person wanted to be in their own journey. And so then we also talk about how can the therapist support grounding, touch. We are available to hold hands or maybe place a hand on a shoulder. So we talk in depth about consent and touch, how the couple wants to be set up. And then I think we have a little bit more on the actual space. So our couples are going to have eye shades on and headphones. This allows each person to be in their own experience with the music. The music is instrumental so that it has an arc and can guide the couple, but is not distracting, doesn't pull them in a direction with language that is different than their relational intentions. And then with each individual of the couple having their own headphones, they're able to control their volume. So if they want to come out and talk with the therapist, they can without disrupting their partner. And the entire session is going to be about 2 to 3 hours. There is going to be some time carved out to kind of revisit those intentions, make sure kind of both people or all people are kind of ready to go into the medicine session. We use sublingual ketamine in our practice. And so there's about 15 to 20 minutes of swishing the medicine. It's absorbed through the mucous membrane and then spitting out the medicine. The actual medicine experience is going to last about an hour. There's that 15 to 20 minutes and then kind of a little bit more of a drop in. Kind of the peak experience lasts somewhere between 30 and 60 minutes, and then couples will slowly start to come out and we'll do some gentle integration. This is not a point in time to be doing any sort of kind of skills or challenging of thoughts. It's really just a moment where couples can start to kind of share any emotions that they experienced. Maybe there were some memories or visuals or physical sensations that were really meaningful. So we can just start to kind of bring to light what came up during the medicine session. It's going to be kind of inward focused for the majority if you're doing a psychedelic dose. Kayla's going to talk a little bit more about all of the different dosing options. But primarily inward focused. And then we really want to talk with the couple about kind of what they already have in their toolbox that allows them to lean into experiences. We know that in any psychedelic experience, if we try to control it or manipulate it, that is going to lead to a difficult time. And so we really just want to be kind of curious, open, willing. And often people will have experiences doing that in other aspects of their life. And so we can kind of talk about what has that been like? What did you use to kind of lean into something that felt challenging? And then sometimes people just have really easy, beautiful, smooth experiences, and there's nothing challenging that comes up. So every experience is a little bit different. And you're going to be working with prescribers. We're psychologists, so we don't prescribe ketamine. We work with MDs and nurses. And so they'll be doing kind of a full medical history. If there is a need to monitor blood pressure kind of during or just before and after, we'll talk with our prescribers about all of that. And then sometimes people do get nauseous. And so we always have a bucket. We talk with them about if anything's happening with you physically, come out, talk with us. We're here for you. We're going to support you. Whatever it is fine. We'll navigate it together.
So once you have completed your assessment, you've built your case formulation, gone over the feedback with the couple so they understand why we're using ketamine and how we're using ketamine, you've done your preparation, they're ready to go, now you're ready to do your medicine session. So let's talk about a couple of different dosing models that you might consider when working with a couple. Chandra already described this a bit, so just as a quick reminder, we're going to begin with a drop-in. We really like using some kind of custom meditation here that you can either find or read for the couple that really emphasizes their relational intention. In general, we're wanting to cultivate calmness, openness, curiosity, all of those kinds of good qualities. We really like the 7 attitudes of mindfulness as an emphasis here. Anything that's going to help people be open and flexible in their journey. Folks are going to start inward, wearing eye shades and headphones, and then typically there is some time for connection in the session as well that will vary a little bit depending on what kind of ketamine dose they're using, and then we'll shift into beginning integration toward the end. In terms of the different dosing models that you might consider, we've identified 4 here that are sort of the main, I think, options to consider. This is a busy slide, so I'll briefly go through sort of the different use cases and pros and cons of each of these. The point that I want to emphasize here is that this is connected to your treatment plan, right? Your choice of dosing model is connected to your case conceptualization and your treatment plan for the couple and how and why we're using ketamine, right? Your comfort as a provider and the couple's preference absolutely plays into this, but really we want to have this choice of dosing be anchored in our treatment. Solo dosing is when only one partner at a time doses. So the other partner might still be present either as a sitter or as a chaperone, which are slightly different things. Sitting is sort of a space holding role, actively creating space. Chaperoning is sort of you're there and available for emergency backup, but not really involved in the session. In both cases, it's really important to discuss what that role means because most importantly, what it is not being their therapist, right? We don't want the other partner thinking that they need to be a coach or a guide or a therapist for their partner, right? That's your job as the actual therapist in the room. Some folks prefer solo dosing for a first ketamine experience so that there's only kind of one person's experience to manage at that moment. But also there might be really good uses of solo dosing depending on the couple's presenting issue. So if you have a couple where they are really struggling to be present and vulnerable with one another, solo dosing may be a more appropriate way of starting. If you have a couple where the dynamic is such that one partner tends to really lose themselves in taking care of the other and the other partner kind of takes up all the space in the room, shifting that dynamic by having the caretaking partner be the one receiving the ketamine dose and the usually care receiving partner be present with them, holding space. That can be a really powerful way to shift that dynamic. So those are a couple examples. There are lots more reasons why you might choose solo dosing, but again, it ought to be connected to sort of your case conceptualization and how you're using the ketamine. When we think about then dual dosing, this is in Chandra's and my practice, this is really where we tend to do most of our work. We almost always do dual dosing unless there's a really strong reason not to. You have a couple of different options. We might think about doing a psychedelic dose, which is a full dissociative dose. This is typically the full dose that your patient is going to be prescribed by their prescribing doctor, right? Which again is not an anesthetic dose, but it is a full psychedelic dose. This dose is higher, designed for an inward journey, right? So most of the session is going to be spent with both partners kind of inward. They are dosing at the same time, even if they're not interacting and they're together in the same room. And there is something that is really special and important about sharing that space together, even if they're not interacting. A lot of their healing interactions are going to be occurring kind of toward the end of that session as we're shifting into integration and during the outside integration sessions that happen the next day or over the following weeks and months. What we want to make sure that we cover for the dual psychedelic dose is what the relational intentions are, the relational set or mindset that folks are taking into the session. And sometimes that can be, a very inward kind of focused intention that is still connected to the relationship, but we want to make sure that they're holding that in mind. A psycholytic dose, or sometimes you'll hear this called a relational dose. This is a lower dose of ketamine. Typically, we see this work around 50% or so of the prescribed dose. Again, you're going to be coordinating care with the prescribing doctor, so you make sure that you run all of these dosing decisions by the prescriber if you are not the prescriber yourself. In a dual psycholytic dose, both partners are dosing at the same time, but the dose is a bit lower, which really can facilitate more interaction. So couples are less inward and more interactive with one another. This means that a little bit more therapist guidance is needed for the medicine session, some gentle prompts for them to explore. The session is still driven by your couple though, right? You're not entering into the session with an agenda or, as Chandra said, with a lot of skills or, psychoeducation here. It's really driven by the couple's interaction, and you're there to scaffold and support. We do still typically have folks begin with an inward period, even during psycholytic dosing sessions that'll last, 15 to 20 minutes or so. The last dosing model that we have on this slide, we're calling augmented couple therapy. This is not something we use very often in our practice, but we're seeing a lot of practitioners out there utilize this. And so we want to make sure that we're covering it and guiding folks in how to be really thoughtful about the use of this model as well. In augmented couple therapy, both partners will take a very small dose of ketamine right before a traditional 60 to 90 minute couple therapy session. I've seen practitioners use, maybe like a 1/4 of a full dose of ketamine here. And that means that partners will still be under the influence, but much more aware and much better able to engage in, the traditional work of a couple therapy session. And the goal here is to utilize the increased openness and softness from ketamine to facilitate whatever work you're doing with the couple in the room. I will say this is a little bit less established. I think there are some important considerations here, like they're still under the influence. So how does consent for discussion work in this context, and all of that is really important to discuss ahead of time. So when might you choose one versus the other? I talked about this a little bit already, but one kind of shortcut to think about this is, are we working on an intrapersonal, meaning within myself, kind of place in this pattern? Or are we working on an interpersonal, meaning between the two of us, kind of place in this pattern, right? So couples may get stuck anywhere on this infinity loop. And if where we're getting stuck at this moment in time is somewhere in my intrapersonal process, what occurs in me, maybe I want to work on getting more in contact. Excellent driving of the slides, Chandra. Top tier. Getting more in contact with my own vulnerable emotions, getting more comfortable with saying those out loud. Maybe a psychedelic dosing where I'm more inward, right? Where I'm really focusing on my own internal process. Maybe that's more useful. On the other hand, if where we're getting stuck primarily is something about the interaction between us, right? Can we hold space for one another's vulnerability? Can we, really make room for us both to show up in this space? Maybe we're going to use a lighter psycholytic dose so that there can be more interaction. We can work on this more interpersonal dynamic. This might shift over time, right? This is one example of how you might start with solo dosing, move to a big dual psychedelic dose, and then maybe later on we're sort of more doing an interactive focus. So we're going to shift to a psycholytic dose, and then maybe we're ending with doing some real juicy couple therapy sessions augmented by a little ketamine. This is one of many possible kind of dosing trajectories that you might use in your practice. What's really important is to match the dosing to your treatment plan and to where your couple is in their progress over time.
All right. And then after our medicine session is when we're going to move into integration. And so this is where we really make meaning of what we experienced during the medicine session. And this is a quote that we really like. So Integration is kind of this higher level understanding of what just happened during this medicine session so that we can actually make changes in our life moving forward. And we like to think of integration as kind of putting together the pieces of a puzzle. So if we think about a medicine session as in kind of taking our box of puzzle pieces and shaking it up, integration is kind of dumping those puzzle pieces out and starting to create a picture that makes sense. We talked a little bit about this like gentle integration that happens immediately following the medicine session. And that may be just starting to flip the puzzle pieces over. Often people have visualizations of kind of being, Kayla just had a session where someone saw their partner as like a little fairy moth that was kind of placing flowers around. So we may have these kind of beautiful images. I've had people kind of feel like they're floating in water. We have kind of floods of emotions that move through us. And so this is really just flipping those over. We don't have to make sense of them immediately, but what actually happened to me? What did I feel? What did I see? And then we start to fit them together. So what did that experience actually mean for me, for my relationship? And how do I want to make a change going forward? And so we can kind of follow these 3 steps of kind of processing what happened. Then we're going to work to soften into those boxes that were below the surface. And then we want to actually shift aspects of the pattern. And this is a lot on this slide, but the way that we're going to do it is by looking at all of these different components. And Kayla and I put this together thinking about what are all of the different intervention strategies that we learn in evidence-based couple therapies, and what are the actual kind of names of those strategies. So rather than kind of pulling from evidence-based couple therapies and calling them, we practice integrated behavioral couple therapy. So kind of 2 primary strategies there are empathic joining, so joining around the more vulnerable emotions, and unified detachment, coming out of the pattern and kind of looking at it together. Every couple therapy has kind of what they call these different strategies. We want this to be accessible to everyone who has any couples experience. And so we're calling these strategies what they actually are, right? Naming and identifying emotions, increasing tolerance of feelings, right? Softening and heightening into vulnerability. So in our training, we will kind of practice all of these together. If you're doing good couples therapy, you already know these, and maybe there's some other strategies that you're using. But because we wanted to make this accessible to everyone, we're using the actual kind of language for what these are behaviorally so that we can all be on the same page. We can all practice together. And then it'll really depend on, as Kayla said, kind of where your couple is feeling stuck. So as we move through integration, first it'll be kind of just sharing what happened, right? Then this softening, then identifying where we're getting stuck. And this will start to feel kind of more like traditional couples therapy as we move forward in integration, as we're working to shift this pattern. And then, of course, we want to encourage our couples to continue integration together in their daily life. So having conversations about what they are feeling, maybe naming a pattern when it comes up, working together to shift it. We do not want people to be with us in therapy forever. We want them to be able to do this work that we're doing together on their own. Of course, we're always available. They can always come back if they're feeling stuck. But these are things that people can learn to do with their partner outside of therapy. Lots of people like to journal or do creative projects together, spending time in nature, going for walks. So we can talk with the couple about what are strategies that you already have or want to integrate that help create some space for you to be reflective, continue thinking about what you've experienced during your medicine session and what you want to shift in your life going forward.
All right. And so, integration, right, has kind of its traditional meaning in psychedelic assisted psychotherapy, which is how do we integrate our medicine experience into our daily lives. We also think about integration here as how do we integrate this use of ketamine assisted therapy into our couples practice in a way that that is really synergistic. And so we don't think about couples cap as being separate from couple therapy. We think about couples cap as sort of enhancing and being a part of the couple therapy that we're doing with couples for whom we use this. So what this can look like if you are a person who really likes to make things tangible, we will typically see couples who are coming to us specifically for couples cap, or where we all decide kind of early on, yeah, we think ketamine treatment's going to be a really helpful part of your treatment plan. We'll see them for assessment for 1 to 3 sessions. That typically involves at least one conjoint assessment session and at least one individual assessment session with each partner. That's a pretty, I think, typical practice in many forms of couple therapy, depending on your training. And then we'll see the couple for 1 to 2 feedback and preparation sessions, going over how we're understanding their formulation and where they're getting stuck, and showing them that pattern, preparing them for dosing, deciding on what dosing model we're going to start with. And then there's a sort of flow, right, of dosing to integration. So we'll have one dosing session followed by, at minimum, one, but probably more, integration sessions, right? So we've mentioned you can begin doing gentle integration right at the end of the dosing session. And then the morning after, ideally, their ketamine session, we're going to do an actual dedicated integration session. And then the following sessions are also integration, in the sense that we're integrating our medicine experience and we're also integrating that work in the sort of traditional couples work that might be more familiar to you. And so you can repeat this dosing and integration cycle, anywhere from 2 to 8 times. We typically see couples for, I don't know, maybe 2 to 4 medicine sessions total in a course of treatment. There aren't great data on what the right number of ketamine sessions is for a couple just yet. We hope to be gathering that data going forward. But really, again, this is tied to your treatment plan, right? Typically, we'll offer couples a dosing session about once a month, although, again, there's a lot of variability in that. And what we're looking for is, sort of, why are we using this ketamine session to enhance their treatment right now?
And if any of you are familiar with the research on ketamine-assisted therapy, most of that's been done, as Kayla talked about in the beginning, with kind of severe depression or suicidal thoughts or behaviors. And so those protocols typically are 6 sessions spaced 1 to 2 weeks apart. And that research is really looking at ketamine as the intervention. And so the reason why we're thinking about this differently than that is because the intervention is couple therapy. Ketamine is a tool that we're using to kind of enhance the mechanisms of change within couple therapy. And so why we don't quite know what is kind of the number of dosing that is typical in this protocol is because we need to collect more data on it. Maybe for one couple, one medicine session is enough to make a big shift in that pattern. And then we can do the work of couple therapy kind of just with that one big shift. And maybe with other couples, it looks a little bit different. So this is something that we're still kind of learning.
If anyone listening knows any philanthropists who are interested in funding a clinical research study on ketamine couple therapy, have them give us a call.
All right. So we saved plenty of time for questions, and so we'll start looking at those. And again, today was kind of just an intro into all these different pieces. We are doing an in-person training in San Diego at the end of October. And so we have video recordings of real couples that we'll be going through. We'll be doing kind of a lot of role plays with each other, having interactive and didactic learning. And so if you are interested in doing that with us, there's a QR code to register. And then we also have sliding scale spots available. So if this is kind of out of your range right now, we still really want you to be there if this is something that's important to you, if you want to be incorporating this into your practice. So definitely do the sliding scale application. If you have any questions, you can also just reach out to us, info@enamory.org, and we would love to chat with you about anything that's coming up.
We know that this date is coming up pretty quickly. There will be an online training for folks who prefer online in spring of 2026, and we'll release that date really soon. But we really hope that many of you consider coming to San Diego to join us, because being in person, Chandra and I are leading this training ourselves, and so being in person with all of you is really, really special. You'll kind of be among the founding cohort of our online community as well. And then just to emphasize something else that Chandra said, if the only thing holding you back is the fee, the registration fee, reach out to us and let's talk about how we can make it work for you, because we really want you there.
And yeah, what Kayla just talked about with the online community. So we are going to have a platform for therapists to do consultation with us. So if you are coming to this training, then you'll be part of that first cohort. And so this will be the only time that it is going to be this kind of intimate. Kayla and I are going to be doing the consultations at least every other week, and we'll be kind of in the online community every day answering questions. So if this is a time that you want to incorporate CAP in your practice, it is going to be the moment where we are kind of most connected as we're kind of laying the foundation of all of these different pieces. Thank you for being with us today. We're going to send the link out to everyone for this recording. And then if you want a copy of these slides, we're happy to share those also. And we'll move over for the last about 15 minutes to the questions and just have a bit of a conversation with all of you.
So pop your questions in the chat on the YouTube Live. I'm seeing a couple of them come in here. We got one that says, can you talk about what it would look like to facilitate the CAP portion in conjunction with another couples therapist who's doing the longer term work?
Yeah, you just want to make sure that you are kind of collaborating with that therapist. You would still do kind of preparation with the couple, depending on how close you are with the therapist. We have 6 therapists in our practice. And so sometimes if this may happen, if like someone's doing couples work with the couple and then maybe one person just wants to do a medicine session. So we can get as much feedback as we need on their assessment. So depending on how close you are, you're going to need the information going into the medicine session where you have the pattern, you have the relational intentions, you have done preparation. So you probably are still going to need to do like 2 to 3 sessions before the medicine session. You would do the medicine session and then have at least kind of 1 to 3 integrations. And then they would just continue couple therapy with their therapist that they've been doing couple therapy with.
Yeah. We love doing this. I will say at Enamory, like I love it when couples therapists reach out to us and say, hey, I have a couple who wants to do CAP. I'm not trained in it. Can you work with them for the CAP portion? I think what makes it work really well is, as Chandra's saying, when we can have really close care coordination to make sure that the CAP is enhancing what the couples therapist is trying to do. And that the therapist is practicing in a way to best leverage the benefits of the ketamine medicine sessions.
And if you're a therapist and reaching out to someone to do the CAP session because you don't know how to do couple CAP, but maybe you want to do couple CAP, then reach out to us because you can definitely do it if you have couple therapy training. There's lots of places where you can get kind of an intro to couple cap. So you could do that in the next month, and then you could come to our training and you could do the cap session with your couple.
Yeah. And, part of that is the online community. There's another comment here that says the online community sounds great. Thank you. We agree. We love the online community, and we're really excited to open it to the public. So I'll talk a little bit about what we're going to be providing in the online community, so you can think about if that's a good fit for you. But really, it's designed to support people in learning and implementing this in their own practice. So we provide ongoing consultation on probably a weekly or biweekly basis for folks, so that you can bring your active cases and get real-time support in those. Those are going to be live with Chandra and I. There is also discussion boards so that you can post any questions you have or things you need support with and get real-time feedback, not only from us and our team, but also from your peers. And it's a great place to just get peer support, check in about your learning. You'll have access to all of our sort of recorded materials and handouts that you can use in your own practice and things like that. So we really want it to be a very active and vibrant and supportive community, and we're really excited to build that with you all. We are also very excited to hear from you what would be most useful for you. So you can also let us know what you want us to build. All right. Can you talk about the JC component? I'm assuming you're a Journey clinical person. Thanks for being here. Would each partner do the medical intake? Would each need to meet criteria for medical necessity?
Yeah, so within Journey Clinical or working with any prescriber, it's the same thing with some other prescribers that we work with also. Both individual from the couple or however many people are in the relationship, they all have to do their own medical intake and get their own prescription. And there are lots of different presentations that you can get a ketamine prescription for. So that, again, will be kind of at the discretion of the medical prescriber. But yes, they both need their own prescriptions.
Yeah. There's another question about that too. What diagnosis is usually being used to prescribe ketamine in this context? And yeah, this is a kind of evolving gray area, I would say. And again, I'm going to speak about this not as somebody who's a medical prescriber, so don't take this as medical advice or advice for you if you are a prescriber. What we typically see is that, one, relationship functioning and mental health are closely intertwined. So it's rare that we have a couple where at least one partner, doesn't meet for anxiety or depression or something like that. At minimum, sort of an adjustment-related disorder is very common, and I have seen folks, write ketamine prescriptions off-label for adjustment. All ketamine prescribing is off-label unless it's Spravato, right, for TRD. So, so I think that is often, sort of the way that folks think about prescribing in the context of couples is what individual concern is the relationship either causing or related to that they're prescribing the ketamine for. Both partners might not qualify for a ketamine diagnosis, either because they don't have a qualifying condition or they have some sort of medical contraindication. And that's another instance where you might consider a solo dosing model where the work is still with the couple, but only one person is using ketamine. Maybe the other person is doing meditation or breath work or some other kind of alternative. Okay, have you looked at THC, CBD, edible assisted couple therapy?
I have not done any of that work with couples. We have a colleague at the academic institution that we've been connected with that was looking at that connected to PTSD. But Kayla, have you seen any research with...
Not with couples, no.
Yeah.
There's a large body of research, obviously, on MDMA or Molly used with couples, and some other research on sort of older classic psychedelics taken in couples context, psilocybin, LSD. I don't think I've seen anything on cannabis with couples. If anybody sees that, please send us the citations. We'd love to read about it. Obviously there's a lot of shared mechanisms here in terms of an altered state of consciousness that can help us make contact with things that are otherwise out of reach for us, whether that's new insights or, emotional experiences. And cannabis works differently than ketamine, depending on, or, in terms of what it does in the brain and, how it sort of shifts the way that we function. I think one concern I might have is what we don't want is for couples using ketamine, cannabis, or any other substance to numb out and avoid. That's not what we're doing here. There are, some folks who use ketamine therapeutically, supposedly, in a way that I don't think is likely to be very helpful, at least not with couples, because it has the function more of pulling us out of our experience rather than helping us lean more deeply into our experience together. And so I think we want to watch out for that with whatever kind of medicine we are choosing to use.
Yeah, I think that's coming back to like why the therapeutic container is so important. That cannabis and PTSD study, the kind of mechanism in that study was thought to be that there would be more ability to move toward distressing emotions, kind of with that softening that may come with cannabis. And so the intentions that we set are really important. The therapeutic setting is important because, as Kayla's saying, with ketamine, it can be used to avoid it. And I think often recreationally, it's used to dissociate and kind of move to a place where you don't have to be kind of present or do any sort of work, and you can kind of just be floaty and dissociated. So what we are using any psychedelic for or any medicine for is important. What is the purpose? What are the intentions? What is the setting?
Anybody who's been in a consultation group with Chandra and I, or if you want to come to a consultation group with Chandra and I, you'll hear us say again and again, avoidance is the enemy. We want to help people not avoid the hard stuff. We want to help people thoughtfully and mindfully and kindly engage in challenging experiences, challenging feelings, challenging interactions, because that's where healing actually occurs. That's the end of the questions that I am seeing. A couple of folks noting that you'd like the slides shared. We are happy to send the slides out along with the recording of this. You can just reply to that email and ask us for the slides or the handouts or whatever it is that you would like, and we're very happy to share those. If anybody else has more questions, now's your time. Pop them in the chat. 7 more minutes. While you're all thinking of questions, we'll say one final time for the training that we're doing on October 25th and 26th. So it's going to take place at this really beautiful building on the UCSD campus in San Diego. There is a hotel within a 5-minute walk if you're going to travel into San Diego for this. And so the whole experience is going to be like really fun and nice. Meals are provided. It's going to be an opportunity to connect with your peers and to connect with Chandra and I. We're really excited to be there with you all in person. We do a lot of these sort of online presentations, so being in person with people is a real treat. And we're really excited to share with you some of the case videos of real couples doing CAP together that we have filmed with these couples' incredibly generous permission that we can share with you, and also to practice some of these skills live and do some live work with you. So please join us for that if you're considering it. I see a question. Have you ever had conflict or adversarial interactions arise during a couple's CAP session?
I haven't had any conflict arise during a couple's CAP session. I've had couples talk about, as they're coming out, talk about very challenging experiences. But yeah, mostly people when they're coming out of a CAP session are just very squishy and vulnerable. The pace is really like slowed down. Having a conflict in that state would be really challenging.
Yeah, most people experience ketamine as very calming. That's like
Hmm.
more so than any other medicine that I've worked with. I hear people come out of a ketamine session going, I feel this inner quiet. Like
Mm.
my brain is quiet. And it
Yeah.
feels very peaceful and relieving for a lot of people. In that quiet space is where folks can really lean into things like connection with a partner. So I think because of that, no, conflict is not super common. At the same time, one of the things that we will talk about in the training, and one of the things we do talk about, is you do want to be prepared for holding the space in a way that is safe and that protects it from conflict, right? So if you did have a couple come out of a session and start being like, my whole medicine journey, I was thinking about the way that you never pick up your socks and you go right into that critical pattern again, then I think you'll want to be prepared for sort of redirecting that to, help that person focus inward and share softly and gently, probably in the same way that you would in a traditional couple therapy session. Have you seen breathwork assisted couple therapy? I have not. It would also be really interesting.
Mm-mm. Yeah, I haven't. Um, I'm sure though I mean, with all of the breathwork retreats, even if there's
Yeah.
nothing published, I'm sure that there's like maybe case studies or people who have just written about that. So, um, yeah, I mean, a lot of breath work happens at retreats, and a lot of retreats happen with couples. So I'm sure that is out there in some sense.
Yeah. Um, Breathwork people or folks who have experienced that, let us know. We'd love to hear from you about your experiences. So, one of the hats that Chandra and I wear is we are researchers. And so, in addition to studying our own model, this ketamine assisted couple therapy, we are also really curious to learn more about other models that people are using and other sort of things that are happening out there so that we can, build the best possible care for folks. So, if you all know something about cannabis assisted couple therapy, breathwork assisted couple therapy, send those resources our way. We'd love to learn more.
I'm sure actually, so Kayla and I did our MDMA assisted therapy training with Michael and Annie Mithofer. And the way that they got into psychedelic therapy was Michael started going to breathwork
Yeah.
retreats, and Annie was initially like kind of hesitant and then leaned in, and they kind of did this breath work together. So I'm sure they've probably gone to couples breath work retreats or at
Yeah.
least done it
We can
together.
ask them.
So yeah, we can probably find out about that.
Couple more questions. We've got 2 minutes, so we'll try to answer these really quickly. Average psychedelic dose. It's psychedelic but not anesthetic. Typically, we see folks, when I mentioned we use sublingual, we'll see folks write for about 300 milligrams in a sublingual troche for like sort of the average full psychedelic dose. In the training, how many nights are we likely to need to be there? The training is going to be all day, Saturday and Sunday. So we would recommend coming in Friday evening and then leaving either Sunday evening or Monday morning.
And the hotel block, I think, is Friday through Monday. And we can book until October 3rd to get the hotel block, which is $199 a night. Again, it's a 5-minute walk. It's at the La Jolla Marriott. So
And then I think I missed a question farther back about how much is the training. The training is $1,200 at full price. As I mentioned before, if that's not accessible to you, we really encourage you to fill out our sliding scale application and let us know what is accessible to you, because we want this training to be available to everybody who wants it.
And it's really important to us to bring people into the first cohort in the community who are excited about doing this work. And so, describe to us why you're excited about doing this work and how you're going to use this training and how you're going to be involved in the community and with us. This eventually will be a train the trainer model. And so we want people, particularly here in the beginning, who are passionate about this work.
Thank you all so much for being here with us today. I was going to say this morning for those of you on the West Coast, or today for folks who are elsewhere in the country or the world. We are really pleased to share this time with you and to share this model with you, and we can't wait to stay connected. You'll all receive a follow-up email from us with more information about the upcoming training and with a link to the recording for today.
Thanks, everyone. See you later.
Bye.